The power of aspirin, benefits, risks, and uses. The role of aspirin in medicine. Aspirin is a widely used medication with a variety of benefits and risks. It has been used for decades to relieve pain, reduce inflammation, and lower the risk of heart attacks and strokes. In this presentation, we will explore the benefits, risks, and various uses of aspirin in different medical conditions. Aspirin, chemically known as acetylsalicylic acid, is a widely used medication with a remarkable history and multifaceted mechanism of action. Its chemical composition comprises acetyl groups and a salicylate compound. This compound's mechanism of action involves inhibition of the enzyme cyclooxygenase, COX, thereby blocking the production of prostaglandins, which are substances involved in pain, inflammation, and fever. This inhibition leads to its analgesic, anti-inflammatory, and antipyretic effects. Historically, the use of aspirin can be traced back to ancient civilizations where willow bark, containing salicylates, was used to alleviate pain and fever. However, it was not until the late 19th century that aspirin, in its synthesized form, was developed by German chemist Felix Hoffmann, working for Bayer, a pharmaceutical company. This development revolutionized medicine, as aspirin became one of the most widely used and prescribed drugs globally. Its introduction marked the birth of the class of medications known as nonsteroidal anti-inflammatory drugs, NSAIDs. The discovery and development of aspirin led to significant advancements in pain management, particularly for conditions such as headaches, muscle aches, and arthritis. Moreover, its cardiovascular benefits, including its role in preventing heart attacks and strokes, have been extensively studied and recognized. Over the years, ongoing research has continued to uncover new potential applications for aspirin, including its role in cancer prevention and treatment. Medical uses of aspirin. Pain relief. Aspirin is commonly used to relieve mild to moderate pain, such as headaches, toothaches, and muscle aches. Fever reduction. Aspirin can help reduce fever by inhibiting the production of certain chemicals in the body that cause fever. Anti-inflammatory effects. Aspirin has anti-inflammatory properties and is often used to reduce inflammation and swelling associated with conditions like arthritis and injuries. Aspirin exhibits notable cardiovascular benefits primarily through its antithrombotic properties. By inhibiting platelet aggregation, aspirin reduces the formation of blood clots, thus lowering the risk of myocardial infarction, heart attack, and ischemic stroke in individuals at high risk or with a history of cardiovascular events. This effect is particularly crucial in patients with atherosclerosis or those who have undergone coronary artery bypass graft surgery or percutaneous coronary intervention. Additionally, aspirin's anti-inflammatory properties may contribute to its cardiovascular benefits by reducing inflammation within arterial walls, potentially slowing the progression of atherosclerosis. However, it's essential to consider individual patient factors, including age, risk profile, and bleeding risk, when prescribing aspirin for cardiovascular protection, as its use may not be suitable for everyone. Emerging research suggests that aspirin may offer potential benefits in cancer prevention, although the evidence is still evolving and requires further investigation. Some studies have indicated that regular, long-term use of aspirin may be associated with a reduced risk of developing certain types of cancer, particularly colorectal cancer. Additionally, aspirin may have a protective effect against other cancer types, including breast, prostate, and lung cancers, although the evidence for these associations is less consistent. The mechanisms underlying aspirin's potential anti-cancer effects are not fully understood, but may involve its anti-inflammatory properties, inhibition of cell proliferation, induction of apoptosis, programmed cell death, and modulation of immune responses. However, the decision to use aspirin for cancer prevention must be weighed carefully against potential risks, such as gastrointestinal bleeding and other side effects. Individuals considering aspirin for cancer prevention should consult with their healthcare provider to evaluate their individual risk factors and make an informed decision. Ongoing research continues to explore the role of aspirin in cancer prevention and treatment, aiming to elucidate its mechanisms of action and optimize its potential benefits while minimizing risks. The use of aspirin during pregnancy requires caution and medical supervision due to potential risks to both the mother and fetus. It is generally not recommended for routine use, especially during the first and third trimesters, unless specifically prescribed by a healthcare provider for certain medical conditions. Low-dose aspirin may be prescribed in some cases to prevent conditions like preeclampsia, but women should always consult their healthcare provider before using aspirin during pregnancy to discuss potential risks and benefits. The dosage and administration of aspirin depend on the specific medical condition being treated or prevented. For pain relief and fever reduction in adults, the typical dosage of aspirin is 325 to 650 milligrams every 4 to 6 hours as needed, not exceeding 4 grams in 24 hours. However, lower doses, e.g., 81 milligrams, are often used for long-term cardiovascular protection. For cardiovascular disease prevention, including the prevention of heart attacks and strokes, low-dose aspirin therapy is commonly recommended. The typical dosage for this purpose is 81 milligrams, often referred to as baby aspirin, to 325 milligrams daily, as prescribed by a healthcare provider. It's essential to follow the provider's instructions carefully regarding the timing and duration of aspirin therapy for cardiovascular protection. When administering aspirin, it's crucial to take it with a full glass of water and with food if gastrointestinal upset occurs. Enteric-coated aspirin may be used to help reduce the risk of stomach irritation, but it's essential to swallow these tablets whole and not crush or chew them. As always, individuals should consult with their healthcare provider for personalized dosage recommendations and guidance on aspirin use. Aspirin can interact with various medications, potentially affecting their effectiveness or increasing the risk of side effects. Some notable drug interactions include 1. Anticoagulants, e.g. warfarin, heparin aspirin can potentiate the effects of anticoagulants, increasing the risk of bleeding. Concurrent use should be closely monitored by a healthcare provider, and dosage adjustments may be necessary. 2. Nonsteroidal anti-inflammatory drugs, NSAIDs, such as ibuprofen or naproxen. Concurrent use of aspirin with other NSAIDs may increase the risk of gastrointestinal bleeding and ulcer formation. It is generally recommended to avoid combining aspirin with other NSAIDs unless specifically directed by a healthcare provider. 3. Corticosteroids. Aspirin may increase the risk of gastrointestinal bleeding when used concomitantly with corticosteroids. Close monitoring for signs of bleeding is advised when these medications are used together. 4. Selective serotonin reuptake inhibitors, SSRIs, and serotonin norepinephrine reuptake inhibitors, SNRIs. Aspirin may increase the risk of bleeding when used with these antidepressants. Healthcare providers should monitor patients closely for signs of bleeding if they require concurrent therapy. 5. Alcohol. Regular and excessive alcohol consumption may increase the risk of gastrointestinal bleeding associated with aspirin use. Individuals should limit alcohol intake while taking aspirin and discuss any concerns with their healthcare provider. 6. Herbal supplements and natural products. Certain herbal supplements and natural products, such as ginkgo biloba and garlic, may increase the risk of bleeding when combined with aspirin. It is essential to discuss all medications, including herbal supplements, with a healthcare provider before starting aspirin therapy. 7. Methotrexate. Aspirin may decrease the elimination of methotrexate from the body, potentially increasing its toxicity. Close monitoring for methotrexate-related side effects is recommended when aspirin is used concomitantly. Patients should inform their healthcare provider about all medications, including prescription, over-the-counter, and herbal supplements, to minimize the risk of drug interactions. Healthcare providers can provide personalized guidance on the safe use of aspirin in combination with other medications. Risks and side effects of aspirin *. Aspirin carries risks including gastrointestinal irritation, bleeding, Reye's syndrome in children with viral infections, allergic reactions, exacerbation of asthma, renal impairment, tinnitus and hearing loss, and increased cardiovascular risk in some populations. Individuals should discuss these concerns with their healthcare provider before starting aspirin therapy. Use of aspirin in specific populations asterisk. The utilization of aspirin varies across different population groups, necessitating consideration of individual factors and potential risks. Elderly patients may require dosage adjustments due to increased susceptibility to side effects such as gastrointestinal bleeding and renal impairment. Patients with liver or kidney disease may require caution or dosage modifications to prevent further organ damage. Special considerations apply to pregnant women, as aspirin may pose risks to the developing fetus, especially in the first and third trimesters. Children and adolescents should avoid aspirin due to the risk of Reye's syndrome when used during viral infections. Additionally, individuals with certain medical conditions or taking specific medications may require tailored approaches to aspirin therapy. It's crucial for healthcare providers to assess each patient's unique circumstances and consider potential risks and benefits before recommending aspirin use. In conclusion, aspirin is a widely used medication with diverse therapeutic benefits, including pain relief, fever reduction, and cardiovascular protection. However, its use comes with potential risks and side effects that must be carefully considered, especially in specific populations such as the elderly, pregnant women, and individuals with certain medical conditions. Healthcare providers play a crucial role in assessing individual risk factors and guiding appropriate aspirin therapy to maximize benefits while minimizing adverse effects.